From the perspective of enforcement, we've all been working hard together. And like I said, I know you're making great efforts. You're saving lives and you're heroes for it. I mean that. We're not just crash test dummies that can run into a wall and somebody picks us up and reassembles us. It's that situation that's created when you actually damage others. And you only need to look at one of the recent outbreaks south of Calgary to realize how many people have been impacted, how many lives have been changed by a very unfortunate outbreak. And so we're spending lots of time on education. But I'm going to tell you that I'm a little frustrated in the sense that there's some groups of people that don't seem to be getting it. So, starting very shortly, we will be encouraging our bylaw services, who will be working in conjunction with the police services, to use ticketing as a last resort, and we'll be asking them to consider that. And you should know that they will only use it as a last resort, but it's actually protect you and others around you. Um, a reminder that the fine for contravening the public health order is $1,200 per ticket. That's a serious piece of impact, and quite honestly, it's one we've stayed right away from. Since last Friday, so over the last 5 days, our officers have conducted 240 odd patrols and engaged with over 1,800 citizens, providing them with the education. During that same time, 311 has had 152 service requests for bylaw about physical distancing concerns. So allow me to just run through just for a moment. 69 of those calls were about social distancing, 36 about social distancing concerns on private property, and 21 concerns about playground use, 26 concerns related to public gatherings, with less than 14 or not practicing safe distancing with people over 15. Um, Over the same time frame, and I'm terrible at stats, but let me try. There were 182 general inquiries to 311. So people just phoning in, sort of saying, I wanted to go do X. Can I do that, or can I do Y? And so our 311 folks, just a shout out to them for really trying to answer those tough questions for people around what you can and what you cannot do under the current health orders.
I want to remind everybody that we are looking at every decision that we're making here through three gauges: physical health, mental health, economic health. And we're working hard at trying to balance all of those three things. But it's also important to remember that the number one concern right now is physical health. So you heard Tom allude to the outbreak at the Cargill plant in High River. Most of those people are actually in Calgary. And I haven't even seen the latest numbers, but I know that it was creeping towards 800 cases related to that outbreak, about one third of the cases we've seen in Alberta in the last few days. I want you to remember that was one person who may or may not have been symptomatic who went to work. And as a result, somebody's died, unfortunately. A number of people are very ill, and a number of people are in the position where, through nothing they ever wanted to do, they're spreading in the community. This is not over. A lot of folks have been chatting with me and saying, it feels like we're doing the right thing. It feels like we're flattening the curve. These things are true, and we should be proud of how we've worked together as a community to really save people's lives. But I cannot stress this enough. We're not there yet. In fact, since last we spoke, we have had the highest days of increases in cases that we have had since the beginning of all of this. And remember that even if you believe, and I don't think I do, and I know that the public health officials don't, but even if you believe that we're at the peak, remember the peak is only halfway. We have to come down on the other side. Remember that we have to be careful about secondary infection. Remember that in 1918, The Spanish flu claimed 5 million lives, roughly, in its first wave. In its second wave, it claimed over 50 million lives. So we're not done. And so I want to say to everyone, I want to say thank you for doing the work you're doing. I know it's tough. I know that it's getting even more difficult. I know that everybody is on edge. I know that we are all just waiting for the next thing. But I also know it's the right thing to do because together we are saving lives.